Thomas P. Ryan, D.O. I'm board-certified orthopedic surgeon. I practice at SSM Health, St. Mary's Hospital, Jefferson City. My father finished with the Air Force and transferred here in 1967. He was the first surgeon to do a total joint here at St. Mary's. Well, my mom liked to be involved with many things, and she was a nurse, so she got involved with the St. Mary's Auxiliary, and they really needed an ambulance because they were just starting to work with ERs and bring in ER doctors, but there was no way to bring patients there. So they got their own ambulance, and she got all the money together to buy their own ambulance. I always like to fix things, and whether that was from my dad or not, but I like to fix things, and that's how you can do with people, especially with orthopedics. You can fix their body and put the parts together correctly and make them work again. The first thing I talked about when I go in the room, I talk to the patient and introduce myself, and we like to have a little rapport as quickly as possible to make them comfortable. And this may be their first and only time that they've had this problem, and it's a big thing to them. We can figure out what it is and give treatment options, decide what's the best. But the idea would be to make them feel comfortable, and then from there decide what are some options we can do to help them get that better, and what would be a potential outcome of the treatment, whether it be conservative or if we have to consider surgery. One of the main reasons that I went into medicine was, and especially orthopedics, was that I can help them with that particular problem, make that feel better, make their life more functional. And they're entrusting me with their body to help them fix it. And they're very thankful, and that's the main reason I do orthopedics in the first place.